Objectives: review the systematic approach, review U1 protocol, identify and recognize high-risk chief complaints, discuss protocols and treatments, and finally discuss pitfalls. Systematic approach to patient care. First, we want to form a general impression as we come into the scene. Then we want to move into our primary assessment. For the primary assessment, we're looking at exsanguination, airway, breathing, circulation, disability, and then we want to make sure we're exposing our patient. During this time, if there's any life threats, we will treat them as they come up in our primary. After our primary is complete and we've addressed any life threats, we can move into the secondary assessment. Once we move into our secondary assessment, this is where we're going to get a sample or OPQRST, vital signs, and a detailed head to toe. And we will reassess based off of the condition of our patient and severity. Scene safety is the most important thing. Also, we want to make sure that we have our equipment, and we also will need to determine the number of patients and any additional resources that we may need. Remember, we're going to do our primary assessment followed by our secondary. That's where our baseline vitals come into. We also need to determine the severity of our patient at that time. Remember, for our pediatric patients, we want to utilize the HANTEVI and also use the pediatric assessment triangle as we approach our patient. For treatment, we want to apply oxygen with evidence of dyspnea, also ventilation assistance as needed, and we'll utilize the appropriate protocol. For our transport decisions, we want to make sure that we're taking them to the appropriate facility and giving good bedside reports. Also, if the patient needs to be restrained, we want to make sure that we're using approved patient restraint devices. For documentation, we want to complete appropriate run report using the SOAP format for our narrative. Let's take a quick look at the M12 poisoning and overdose protocol. Most common overdoses, opiates. But remember, with opiates, it's not always going to be drug abuse, and it's not always going to be readily available on the medication list. We have to be good detectives, and we have to ask the right questions. Alcohol, heroin, and benzodiazepines also fall into the category of common overdoses. Remember, Narcan only works if it's an opiate-based drug. Obviously, we need to suspect that there's an opiate overdose, and some things that could clue us in on that would be pinpoint pupils and depressed respiratory effort. Let's take a quick look at the P9 Pediatric Altered Mental Status Protocol. For all of our patients, we need to make sure that we are doing the appropriate treatment, obviously, but we want to make sure that we are ruling out some things first. Is our patient a diabetic? Maybe they have a history of seizures. Maybe they have a history of dementia. The list goes on and on. We just need to be good detectives and get to the bottom of what it is and treat appropriately.